Okay, the blood just got done spinning for 5 minutes and it beeped, so it's all done. As I pull it out here, you'll notice quite a difference. It was all red going in. Now we have these different layers. The top layer is the platelet-rich plasma. That's what they refer to as the golden layer there. And then this layer is just a gel that separates the blood cells, the red and white cells, from the PRP. So we're going to take off this full layer right here, and that's ultimately going to be injected back into the knee itself. So turn this upside down. Get all of that healing PRP out of there. And again, this is just very concentrated platelets. And since platelets release robust growth factors over a prolonged period, the goal is to get all of those growth factors and healing chemicals in the knee joint, which we will do. Almost done drilling it all up. Okay. Now I'm going to put a different needle tip on. You're going to use a really small needle to actually do the injection. All right. Okay, so to do the injection, a knee joint injection can be done several different ways, but a lot of times a common way is to go into the outside, or what's known as the lateral part of the knee. So we're going to identify the appropriate landmarks of the knee, and then we're going to clean with this cleansing sponge. We're going to touch it up again here in a minute. But then I also like to numb the patient's skin with this topical spray so that they really don't feel the procedure. It gets the skin nice and cold and numb. Then here we go, real quick injection, 1, 2, 3, poke, good. Now, most patients say that they feel just a little bit of pressure because we're putting quite a bit of volume into the joint, and that's intentional, of course. And as the body absorbs that fluid over the course of a day, that sense of pressure and tightness in the knee decreases, and what's left is the healing chemicals and the platelets from the PRP. So I inject it nice and slowly, let it diffuse throughout the joint, and whether people have problems on the inside of the joint or the outside of the joint, the PRP gets throughout the entirety of the knee joint and the knee joint capsule. So even if Dr. Patrick's knee was hurting more so on the inside, this PRP gets over there. So that's why we're doing the procedure from the lateral outside of the knee. We're almost done. 5, 4, 3, 2, 1, that's it. So I'm going to start to come out with the needle. And that's it. That's the entirety of the procedure.
Great. Didn't feel a thing.
Good. So that's it. And I'll just apply a Band-Aid here, but real nice, simple, easy procedure. And that is PRP for the knee.